first slide shows the contrast of what we got. The normal tissue is up here in the upper right corner. Adenoma, mostly adenoma, is here in the lower left. We did do a reticulin on this, and you might want to keep this pattern in mind because it gets a little bit confusing in the stains. There is a little bit of architecture here, and you can see some banding going on, and it does get a little bit tighter. Still not normal as we go through, and unfortunately by the time we did the reticulin, this piece that's on the lower left was cut through. So I can't prove to you with the reticulin that's an adenoma. I can with the stains though, so we'll get to that. This is part of the normal pituitary that was included just to illustrate how unremarkable it looks compared to another more well-fixed pituitary normal there on the lower right. This is a reticulum stain that we were able to do on what was left, and you can see that it looks largely normal, especially on the top. If I had more time, I might be able to convince you that the architecture is starting to be disillusioned down here on the bottom. These nests are getting to be a little bit big. I didn't photograph the stains on that because I think that's way too close to normal to try to claim that that's part of the adenoma, and the stains did come out on the adenoma. It looks to me like it is, but there's also frank adenoma in other places, so I didn't really want to muddy the discussion of what might have stained, because the stains are also kind of equivocal, and then if I go to a part that's even equivocal for hyperplasia, then there's too many questions. There were fragments that were definitely adenoma. Here's also evidence that we can take that kind of proves that it's adenoma. If this was normal pituitary, it wouldn't be proliferating. And this is a Ki-67, and it shows activity that we called about 3 to 4%, which is probably the upper limit of what some of these fields are here. Definitely maybe 3 to 4%, but then as you can see, there's a little bit of architecture still left in here. This is the normal pituitary, and you can see the Ki-67 is completely dead, 0. Getting to the hormonal stains, I'm going to give 2 sets of these to illustrate why they were kind of hard to interpret. These are the easier ones. Thyroid stimulating hormone, negative. This is a little fragment that was in most of the sections that was definitely adenoma and had no architecture in reticulin. P53 in the patient is also pretty low. And then the Ki-67 in this fragment, I zoomed in on it a little bit so that you can see that it's a little bit increased. Here's the FSH, basically negative. LH, which we thought we saw some fragments or some isolated cells that were positive. In this fragment, maybe 1 or 2 cells, and they look like they're in a band of fibrous tissue anyway. When we go to the second set, that ring of tissue that was also definitely adenoma, this is where I showed the first Ki-67. There's some staining here for FSH that seemed to be percolating down into cells that we called adenoma. And then the LH, which we decided was on the other side of the line and we called negative, seemed to be percolating down, but not quite as far. So this is a case where we don't really know if this is positive or negative. Both of these might be entrapped pituitary cells, or this might be polysecreting or polyreactive. Things that are not equivocal, the ACTH, which goes well with our history. It's nice and dark, and it's positively staining in that small piece that I had before. The prolactin is mostly negative, although we did see some reactive cells. And growth hormone we called possibly positive. It's actually written as strongly positive. I don't know if I agree with that, but if I disagree with my attendings, that just makes me wrong. The ATCH in that other ring of what we called adenoma is also much more strong than the other hormones. So even if we can agree to disagree on the other stains, we can agree that the ACTH is stronger on this and in the other piece too. This patient's prolactin, again, it looks like there are some cells percolating down farther than they should be into what we called abnormal tissue, and the growth hormone, again, cells again percolating down into what we called abnormal tissue. So for that reason, there are 3 stains which we called at least focally positive, and those included ACTH, prolactin, and growth hormone.